When elderly people develop dementia, new and specific care arrangements are required, but also a new daily life balance. Some families choose to manage the situation at home, following the policy rhetoric promoting the aging in place vision. However, opting for home-based solutions has wide-ranging consequences that are generally underestimated. Dementia is a leading cause of dependency and mortality in older populations. In Italy, about 1.2 million people are affected by dementia, and this number is expected to increase. A project called Better at Home, that I coordinated for the CERGAS Research Center with Eleonora Perobelli, Simone Manfredi, Michela Meregaglia and Andrea Rotolo, and supported by Fondazione Ravasi Garzanti, aims to investigate the economic and social burden of home care for older people with dementia living in the Milan metropolitan area.
There are several reasons behind the choice of caring for an older relative at home. First, the aging in place vision increasingly encourages older people to remain in their own homes and keep in touch with their local communities. Second, it is quite common for older people to live in houses large enough to accommodate a caregiver too, which is what older people generally prefer. Third, there is a widespread problem of long waiting times or high fees for accessing nursing or residential homes, and strong barriers in accessing formal care services.
In our research, we started by conducting in-depth interviews with 10 family caregivers to assess their needs. Interviews highlighted caregivers' difficulties in accessing proper information and the perceived lack of a reference point for organizing and performing care activities. Indeed, families find it difficult to understand what services are actually needed to improve well-being and quality of life, without compromising economic sustainability and manageability. Home care, indeed, gets increasingly challenging as the disease progresses, and the caregiving burden can eventually become unbearable.
Then, we conducted a survey with 108 caregivers. First, we quantified a total yearly expenditure of 14,000 euros per person, of which social costs amounted to around 11,000 euros. These are almost entirely incurred by families that have to hire a home assistant. Second, we found that quality of life badly deteriorates, especially for female carers, and combining caregiving with other daily activities appears the leading challenge. Lastly, in a discrete choice experiment, caregivers expressed higher preferences for increased professional home care hours with a mixed health and social care provision, caregiver meetings with professional support, and lower monthly copayment.
Our research shows how complex it is to manage dementia at home. Case management seems the most relevant unmet need, piling high pressure on caregivers. When opting for home-based solutions, families should consider the non-monetary expense in terms of opportunity costs, time, quality of life, and emotional distress, even if these are much harder to quantify. This should apply also to policymakers when comparing home care versus residential care in developing new policies for older people.